Nurse Aide Test Prep Grade 3. Question 1. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C, given a sedative. Option D, ignored until they calm down. The correct answer is option B, encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 2. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B, place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 3. What is the proper ratio of bleach to water for disinfecting surfaces? Option A, 1:1. Option B, 1:10. Option C, 1:100. Option D, 10:1. The correct answer is option B, 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 4. A client's temperature is 101.2 degrees Fahrenheit. The nurse aide should: Option A, document the temperature. Option B, report it to the nurse immediately. Option C, give the client a cold bath. Option D, retake it in 1 hour. The correct answer is option B, report it to the nurse immediately. A temperature of 101.2 degrees Fahrenheit is a fever requiring immediate reporting to the nurse as it may indicate infection or other medical conditions. While documentation is important, reporting is the priority. CNAs cannot initiate cold baths without nursing orders. Retaking in 1 hour delays necessary intervention. Question 5. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A, redirect the conversation to something more pleasant. Option B, provide active listening and allow the client to talk. Option C, tell the client not to worry. Option D, change the subject to the client's care. The correct answer is option B, provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 6. A dying client is breathing irregularly. The nurse aide should: Option A, call the nurse immediately. Option B, continue to provide comfort care. Option C, administer oxygen. Option D, start CPR. The correct answer is option B, continue to provide comfort care. Irregular breathing, Shane-Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 7. What is considered a normal blood pressure for an adult? Option A, 90/60 mmHg. Option B, 110/70 mmHg. Option C, 130/90 mmHg. Option D, 140/100 mmHg. The correct answer is option B, 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 8. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C. The client's weight. Option D. The amount of lotion used. The correct answer is option B. Any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 9. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A. Force the client to participate. Option B. Allow the client to choose and respect their decision. Option C. Leave the client alone. Option D. Tell the client they must participate. The correct answer is option B. Allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 10. A client with dementia becomes aggressive. The nurse aide should: Option A. Restrain the client immediately. Option B. Remove themselves from the situation and seek help. Option C. Yell at the client to stop. Option D. Ignore the behavior. The correct answer is option B. Remove themselves from the situation and seek help. Aggressive behavior in dementia may indicate unmet needs or pain. The aide should ensure safety, step back, and seek help. Restraint requires an order. Yelling escalates behavior. Ignoring is unsafe. Question 11. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 12. Range of motion (ROM) exercises are performed to: Option A. Build muscle strength. Option B. Prevent contractures and maintain joint mobility. Option C. Increase weight. Option D. Decrease appetite. The correct answer is option B. Prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 13. The nurse aide is assisting with morning care. The client prefers to perform their own care. The aide should: Option A. Perform all care for the client. Option B. Allow the client to do as much as possible independently. Option C. Rush the client so they finish quickly. Option D. Leave the room and return when the client is done. The correct answer is option B. Allow the client to do as much as possible independently. Promoting independence is a core principle. The nurse aide should encourage and enable the client to perform as much self-care as possible while providing assistance only where needed. Performing all care undermines the client's abilities and dignity. Question 14. When applying gloves, the nurse aide should: Option A. Wear gloves that fit loosely. Option B. Pull gloves over the cuffs of the gown. Option C. Wear gloves only for blood exposure. Option D. Reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 15. What is the most important action a nurse aide can take to prevent the spread of infection? Option A. Wearing gloves at all times. Option B. Performing hand hygiene. Option C. Wearing a mask. Option D. Isolating all clients. The correct answer is option B. Performing hand hygiene. Hand hygiene is the single most effective measure to prevent healthcare-associated infections. Gloves, masks, and isolation are important but do not replace hand washing. Hand hygiene breaks the chain of infection at the most common transmission point. Question 16. What should the nurse aide do if a client begins to choke during a meal? Option A. Call for help. Option B, perform the Heimlich maneuver. Option C, pat the client on the back. Option D, give the client water. The correct answer is option B, perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 17. A client is having a seizure. The nurse aide should: Option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration, and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 18. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 19. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, are respirations decreasing from 16 to 14. The correct answer is option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 20. The nurse aide's role in rehabilitation includes: Option A, performing all ADLS for the client to save time. Option B, encouraging the client to perform ADLS independently. Option C, telling the client they cannot do anything. Option D, leaving the client alone to figure it out. The correct answer is option B, encouraging the client to perform ADLS independently. The nurse aide's role in rehabilitation is to encourage and assist clients in performing ADLS independently to restore or maintain function. Doing everything hinders progress. Question 21. When measuring output, the nurse aide should record: Option A, urine only. Option B, urine, diarrhea, and vomitus. Option C, diarrhea only. Option D, vomitus only. The correct answer is option B, urine, diarrhea, and vomitus. Output includes all fluids leaving the body: urine, diarrhea, and vomitus. These are all measured and recorded to monitor fluid balance. Question 22. When disposing of contaminated linens, the nurse aide should: Option A, shake them out before placing in the hamper. Option B, place them in a leak-proof bag without shaking. Option C, fold them neatly before disposal. Option D, sort them in the client's room. The correct answer is option B, place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 23. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, When the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 24. A client with dementia is attempting to leave the facility. The nurse aide should: Option A, allow the client to leave. Option B, redirect the client to a safe activity. Option C, physically restrain the client. Option D, call security to escort the client out. The correct answer is option B. Redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 25. Which statement demonstrates therapeutic communication? Option A, you should not feel that way. Option B, everything will be fine. Option C, tell me more about what happened. Option D, I know exactly how you feel. The correct answer is option C. Tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience.